been able to integrate all these models. And the way I do it is if you do a really good subjective, not pursuant to your question of how I integrate it, if you do a really good subjective, you start to hear that they sound more like they're amenable to manual therapy or a McKenzie approach, or maybe they've got a lot of things going around in their head that are maladaptive that you need to address. So after the subjective, it points me which way I want to go as far as my physical assessment and treatment approach. Generally, you're doing a bit of everything, aren't you? When you're treating a patient, you're sort of getting into their head. Even if you're doing manual therapy on them as your primary treatment approach, you might be saying, well, I'm not damaging you, or when you're getting them to do a McKenzie exercise and they get a bit of pain, you're getting into their head to sort of explain to them that you're not damaging anything. So you're sort of incorporating all that stuff together. But what we try to do is say, what's the main problem? So you'll have patients that literally the main problem is they have catastrophic thoughts about their back because doctors or other therapists have put ideas in their head. And yes, they might have a movement fault, and yes, a little bit of manual therapy might help them. But if that's the main problem, you should start with addressing that first, because you're not going to be able to get to the other bits without it. Versus someone might come in and say, I was in a motor vehicle accident 3 weeks ago and I've got a really stiff neck and it's right there. And you ask them questions about what's going on in their mind and they don't seem to be particularly having any bad thoughts. I think, okay, that's going to be beautiful. I'm just going to sit there and do a manual therapy technique on them and get them better. So my thing is your subjective is really the key to guide you in where you want to go in your approach.